then you are with your wife and you want to protect your wife and reassure her, and she's looking at you saying, he's going to make it, right? And you're telling her, yeah, I think so. And inside you're like, I have no idea if he's going to make it.
From a newborn fighting for every heartbeat to a star athlete collapsing without warning.
Hand him the playbook, and that's when I collapsed into sudden cardiac arrest.
We'll show you why some heart problems don't show up on routine tests.
How did that make you feel when they said it was?
I loved crying.
And why heart attacks in women are sometimes missed.
Lots of people die from that, and I didn't. And so I think it is amazing that I'm here today.
The warning signs, the breakthroughs, and the stories that prove survival is possible.
What do you think when you see Monroe now?
No. I see God's tender mercy on us.
The Wellness Files Heart Edition starts right now. Thank you for joining us here on the Wellness Files Heart Edition. We wanted to bring you this special coverage because heart emergencies don't always look the way that you'd expect. They can happen to anyone at any age. And the more you know, the more lives we can all save. It's why we have compiled several stories to help keep you and your loved ones safe. We begin with the story of Connor Shaw, a former NFL quarterback and Gamecock star, once known as a dual threat for his ability to run and throw. But at the age of 34, the threat was to his life as he experienced cardiac arrest in a park in the upstate.
September 17th, coaching my son's flag football game.
Here at Graceley Park in Simpsonville, Connor Shaw says the offense had just scored. His son's team was cheering and celebrating. His wife was taking this video from the sidelines, and then Connor started to feel nauseous.
So I'm making my way over to our sideline to talk to our assistant coach and like, hey man, I'm not feeling good. Hand him the playbook, and that's when I collapsed into sudden cardiac arrest.
At the age of 34, Connor's heart had suddenly stopped beating. The only way to save his life is CPR and an AED.
Caleb, what do you remember from that day?
So I was on this field coaching my son's team. I called a play for our offense and stepped on the sideline, and one of the moms on the team told me, hey, that guy over there just collapsed.
Caleb Carter is a firefighter. He didn't know Connor personally, but rushed over to his aid without hesitation.
So we started CPR, and it was about 5 minutes before other responders got to us, and we got AED on.
So it was 5 minutes. So you were doing CPR for 5 minutes?
Yes.
That is a long time
It's
to do CPR.
a very long time for CPR, yes.
Yeah.
And this is where I dropped. My wife was sitting on the bank here.
Connor says a police officer named Zach also helped during this time. When medics arrived, they used an AED on Connor. The device delivers an electric shock to restore heart rhythm.
Very thankful, and it was a miracle that I was able to survive it.
According to the American Heart Association, more than 400,000 Americans die from cardiac arrest every year. If a patient experiences it outside of a hospital setting, they have a 9% chance of surviving. But CPR or an AED can double or triple a person's likelihood to live.
How did it impact you emotionally? Are there days where you're still like, wow, I'm here?
Yeah, well, it feels like a fever dream sometimes.
Connor says his wife was 8 months pregnant at the time. Now, they just welcomed their 4th child.
My wife still has her moments, and so do I, of just the overwhelming sense of gratitude and how close I was, not to meet my new son last Monday, and have my kids go through life without a dad.
Connor says he now has to wear a Medtronic device under his armpit called an EV-ICD. It can detect sudden cardiac arrest and treat it.
So for whatever reason, there's an electrical malfunction, it would send the pulse, and if I were to go into VFib again, then it would shock me.
So it's almost like having an AED in
100%, yeah, which there is peace of mind that comes with that.
To this day, Connor doesn't know why his heart stopped beating.
I've had echoes and EKG tests. I don't have any underlying heart conditions. I've had, post-genetics testing since this incident. But to answer your question, no, this was just a very sudden thing.
But he feels it happened for a reason. He is now using his voice to start an initiative called the Heart Huddle.
He hopes to get AEDs in as many parks and athletic fields as possible, and encourages people to learn CPR, because if it weren't for Caleb, Connor would not be here today.
I reference Mark 16:15, where you go preach to all creation, and Heart Huddle is going to be a conduit to do that, and hear about more survivor stories, and to praise His name because of it.
Now, a cardiologist in Atlanta is studying why athletes like Connor experience sudden cardiac arrest. I got the chance to talk with this doctor, Jonathan Kim. You can listen to that full interview with the doctor on the podcast, The Wellness Files with Carrie Beal. And did you know a newborn's heart is about the size of a walnut? So imagine trying to do surgery on that. Well, here in the U.S., about 1 in every 100 babies is born with a heart defect. That's according to the CDC. For one family, the first moments of parenthood came with a diagnosis they never saw coming. Their son had several heart defects.
You want to talk about your heart?
Yeah.
From the moment you meet Monroe, you want to smile.
Do you have a strong heart?
Yeah. Yeah.
He welcomes you in with his infectious energy.
In pregnancy, Kaylin had always said, you know, Monroe's a force. He kicks different than his brother does. There's something there.
And she was right. His heart tells the story of a warrior.
We had a normal pregnancy with Monroe. We had 2 anatomy scans. They did not show any birth defects.
Parents Caitlin and Sam Reese have an older son and expected delivery to go just as that one did, but it didn't.
His coloring was off and he was lethargic.
After birth, Monroe's oxygen levels were extremely low. He was taken to the NICU, and then they got the news no parent wants to hear.
A neonatologist came in and basically said, I don't have time to talk because I'm trying to keep your son alive, but he's really sick.
So they said they didn't know if he would live in that moment?
No.
No.
Doctors did an echo of his heart and found he had 4 congenital heart defects. He needed to be airlifted from Greenville to Charleston.
Then you are with your wife and you want to protect your wife and reassure her, and she's looking at you saying, he's going to make it, right? And you're telling her, yeah, I think so. And inside you're like, I have no idea if he's going to make it.
At just 2 weeks old, Monroe had open heart surgery in Charleston. It lasted longer than expected, 12 hours. Afterward, Monroe couldn't function on his own. He was put on life support.
You know, as a man, and I can't speak to Kaylin, but you are totally helpless. And it is an awful feeling.
3 days later, their prayers were answered. His heart started beating on its own.
You see him come out of that like a force. And I think they were shocked at how he came off of that. And for us, not only the relief of him coming off, but the relief of watching him fight back was huge, you know?
Again, a force that refused to leave this earth. After 42 days in the hospital, the Reese family were able to take Monroe home.
That day leaving the hospital was one of the happiest days.
Thanks to therapy and further treatment, today he's a strong 3-year-old. Sam and Caitlin have continued to grow their family with a 3rd child.
What do you think when you see Monroe now?
Oh. I see God's tender mercy on us. You know, that again, that our story doesn't look like other people's. And it could have been worse, and it could have been that. But I see just his hand in his role in Monroe's life and his role in ours, and what's that done for us.
Now connect it to the other one.
The Reese family says they feel blessed beyond imagination. But no, this isn't the happy ending for everyone.
There are families right now that need our help. They're at the hospital. Their babies waiting on hearts for a heart transplant. I mean, I had no idea. And so I'm reminded we still have Monroe. There are families that don't. There are families that are in the waiting.
But research and funding could give a fighting chance to the next little force.
Tell her, who is this with you? God.
God. Special. Who's that right?
Now, there are 2 nonprofits here in the upstate that support children like Monroe. The Emerson Rose Heart Foundation, it focuses specifically on congenital heart defects, and the American Heart Association, which helps with funding research for a variety of heart conditions. Now imagine your chest is hurting. It's hard to breathe and even walk. But doctors tell you everything is fine. It's probably just stress. Would you accept that as an answer? Well, one patient didn't. And thanks to a new test at UNC Health Party in Hendersonville, she found out what was actually wrong.
Courtney Pace is an avid runner. She usually jogs a few miles a day. Until last year, at the age of 36, even walking started to cause pain.
Felt like I was having chest pain. Well, I was having chest pain that would go down my left arm like a heart attack.
She went to the emergency room to get checked out and had an electrocardiogram, also known as an EKG. This measures the heart's electrical activity to diagnose arrhythmias, heart attacks, and other cardiovascular issues. But the results were normal.
How did that make you feel when they said it was?
I left crying.
The pain continued, so she went back.
Especially with the low.
This time, she saw interventional cardiologist Dr. Vincent Kakad with UNC Health Party. He had a hunch about what was happening.
Traditionally, when we see chest pain, the thing that we think about is coronary artery disease or large vessel blockage.
This is the coronary artery. He explains if it's blocked, it can cause a heart attack. But Courtney didn't have blockage here. It's why it didn't show up on an EKG. Instead, she had spasms and dysfunction in the heart's smallest blood vessels. This was detected thanks to a new microvascular test.
It is relatively new, and primarily in big academic centers in large cities. We were one of the first centers here in North Carolina to be able to do it. Here we're looking at your heart.
Here's how it works. Contrast material is administered to the patient to see how the small vessels react to stress.
This is the catheter itself. Yeah.
A catheter is also inserted into the coronary arteries to measure blood flow. The test takes about 45 minutes.
Higher dose of acetylcholine there, and by the time patients leave the post-op area, they have their medications adjusted to personalize their therapy to the things that we know will work in their specific situation.
Thanks to her treatment plan, Courtney is feeling a lot better.
Now I've just gotten back into where I'm starting to walk run, and this weekend I did 2 miles one day, and so I'm starting to kind of pick up the pace and get back into it.
And this is allowing her to live her life again.
Being active in general and being able to play with my kids and run around in the yard without feeling like I'm gonna kill over from a heart attack.
Now again, this test is available at UNC Health Party in Hendersonville. If you're wondering if it's also available in your area, make sure to ask your doctor. And now to a story of a woman who was 33 years old when she had a widowmaker heart attack. It's one of the most deadly forms. But here's the thing. At first, she was diagnosed with pneumonia. So she shares the warning signs that you don't want to miss and how she changed her life afterward.
At the age of 33, Malia Jefferson thought she did a good job of taking care of her body. She tried to go to the gym a few days a week and mostly focused on cardio workouts.
I do have a very strong family history of heart diseases and heart issues. I knew it would be a possibility for me, and so prior to having my heart attack, I had made some lifestyle changes that I thought would help prevent it.
It's why she was surprised when one day she wasn't feeling well.
I just felt incredibly tired. I was having cold sweats. It was almost to the point where I couldn't even make it from my bathroom to my bedroom.
Jefferson later realized she had experienced a widowmaker heart attack. This happens when there is full blockage in the biggest artery of the heart.
Lots of people die from that, and I didn't. And so I think it is amazing that I'm here today.
What really worried her is that she had a 1-year-old daughter.
Oh my gosh, what if I had not survived this heart attack and I would have left her there? That part was probably the most traumatic for me.
At the time of her heart attack, Jefferson says she was working long hours as an attorney.
I think stress played a large part in me having a heart attack at the time. Being an attorney, trying to work towards making partner at a law firm, being a new mother.
Bon Secours cardiologist Dr. Daniel Green says many people don't realize the impact stress can have.
We know that Stress can increase your blood pressure. It often causes people to make bad choices like overindulging in alcohol. And it can cause you to lose sleep as well.
He says right after the holidays, he often sees an increase of patients because they overindulge in food or drink, delay doctor's appointments, are highly stressed, and don't make a plan.
And allow yourself to enjoy the holidays, but just have a plan about how much you're going to indulge rather than limiting yourself or saying you're not going to indulge and then overdoing it when you give in.
Jefferson says she has made many changes in her life since her heart attack and tries to stick to them this time of year. Instead of doing just cardio, she has incorporated strength training.
Just trying to be more conscious of having a well-rounded fitness plan.
She also lowered her salt intake, focused on more plant-based foods, and most importantly, she made time for herself.
It meant setting boundaries. It meant saying, no to things, not putting too many things on my plate.
Jefferson admits it's still a struggle every day, but it's never too late to start.
Always start today. Like you don't have to beat yourself up about what you didn't do right yesterday. You don't even have to beat yourself up about what you didn't do right this morning. You can start right now.
Now, doctors say the symptoms of a heart attack can sometimes surprise people, and they often present different in women compared to men. So here's a look at what you should look out for. Chest pain, that's what most of us think of, but also extreme fatigue is very common. You may feel like you have the flu or experience cold sweats. Lightheadedness and nausea is another symptom, and back or jaw pain. A new study finds women under 55 are more likely to die from a first-time heart attack compared to men. But we are also learning that heart disease in women looks different.
And now we're realizing that when we study women, that women are different, right down to the cellular level, especially the fluctuations of the hormones. That actually does affect the way that women have heart disease, the way that they present with heart disease, the way that they have diagnostic tests.
If you would like to go deeper on any of these topics, listen to the Wellness Files with Carrie Beal podcast. We have these full conversations, including that interview with Connor Shaw, Malia Jefferson, who had that Widowmaker heart attack, and we also have the full interview with Dr. McGregor, who you just heard from right there. And she explains how heart symptoms and risks can look different in men and women. So thank you so much for watching the Wellness Files Heart Edition. If there's a story, question, or health topic you want me to dig into, reach out and let me know.